I guess we're ready.
All right, good morning, Commissioners. Today we'll start budget workshops. Well, the first workshop we had talked about doing today is based off of two positions we have talked about before, but we wanted to put a little more fidelity to what they are. These two particular positions, substance abuse position and the mental health position, had been talked about at several meetings. I know the commissioners have been to several meetings in reference to these positions. So, and we wanted to bring these to you just to give them a little more light, to explain them a little bit more and see where we want to put them if it's going to be a part of the 2019 budget in the end, or we're going to get a grant position. I know for the substance abuse position we had talked about this within the last couple of weeks and potentially getting a grant position in association with the Crime Commission, but we're going to basically give a little more information about those this morning. Tim Coffin will start out first talking about the mental health position. And we also have some stakeholders here. So once that's through, we'll do a little break, and then we'll go into the Sheriff's Office new pay plan proposal for your review. And then that will be it, just those three subjects. Is that all right?
Sounds good.
All right, we'll start out with Tim.
Morning, Tim.
Good morning, Commissioners. As Mike said, we've talked about this position in a lot of different ways in a lot of different settings. We had developed a decision package on it. We decided that we probably ought to talk about it a little bit more, and I'm here representing the work of a bunch of folks in the community that have been working together on this problem for a long period of time. And so I'm going to try and walk through what we've kind of envisioned for a community collaborator to address mental health or behavioral health issues as they impact a number of different systems. So one of the things that we know is that individuals that are experiencing behavioral health problems, they're overrepresented in local emergency rooms, in jails, in police and sheriff encounters, and they are frequent users of the Community Crisis Center. And so because of that, a number of different groups have formed to kind of address different sets of that problem. And one of the things that we would like to see is a coordinated effort. Many of you are familiar with the San Antonio model. There's a coordinated effort with a central figure that kind of addresses, that kind of leads that conversation. And so that's the idea behind this position. We've had a number, as I said, of different groups meeting to talk about these topics. And here are some of the groups: ComCare, Sheriff, Manager's Office. We've had commissioners involved, the DA's office, Health and EMS. Via Christie folks have been involved. We've had folks from the South Central Legislative Delegation involved, WPD, Harold from SAC, schools. NAMI kind of started this all a number of years ago when they first started talking about the Community Crisis Center, and then other regional partners, particularly CMHCs from the area. So what have we accomplished so far? And if you go back to 2013, you can see that we started, and NAMI started that conversation, particularly about the Community Crisis Center, in a way to help folks that may be interacting with systems more frequently than they should because they weren't being treated in the right way. So that conversation started, and then in 2014, the VOCC worked with the sheriff to fund the mental health pod in the jail, and that has made a big difference for folks. We also started consistently training delivering the CIT training for law enforcement officers, and that has made a big difference as well for folks in the community. In 2015, the Community Crisis Center opened, and almost immediately there was a very significant cost savings to a number of different systems, somewhere between $6 and $10 million. And Via Christie at that same time committed to a $45 million project to expand some new inpatient and outpatient facilities and services. And Via Christie has continued to work on that. Their family residency program has expanded to integrate behavioral and primary care health care. In 2017, Via Christie opened their new outpatient center that includes additional psychiatrists in the community, which was a desperate need. And they started up a partial day hospital service as well. We've worked with a number of different organizations on research to help us understand what's going to be most effective. We've gotten input from folks in San Antonio because they've been very effective at what they've done. And we continue to look for funding opportunities. And so some of that's all laid out here. So we've made a lot of progress. And when you look at what is happening at the Community Crisis Center, you can see that services continue to increase. 2017, there's again a significant increase in services because more detox beds became available through some additional staffing and funding there. And so you served over 3,100 folks in the Community Crisis Center in 2017. So the demand is there. We need to continue to work on the efforts that we've done so far and try and expand and continue to serve folks in the right setting. WSU has done a cost savings analysis, and they have proven that this model works. The savings somewhere between $6 and $10 million just in that first year alone, and this shows where those savings are realized. So the state hospital is a big benefactor in the Community Crisis Center that we have. They saved almost $5 million in that 1 year period of time. But there's local hospital savings, there's savings for EMS, PD, the jail, lots of different savings opportunities. So what we would like to see as an ongoing effort and a community solution is that we take a coordinated effort to continue to work on this problem and to continue to serve folks with mental health and behavior and substance use disorders as they interact with all the different systems that they do. One of those benefits could be improved universal screening. So as people enter into one of those systems, they get screened in a consistent way, and so that those mental health needs are identified quickly and they're routed to the right path on a service system. And then we'd also like to make sure that those folks are served in an outpatient setting whenever possible, rather than in the jail or in a local hospital or the state hospital, because we know that outpatient setting services are much more cost efficient than inpatient settings, and it helps the individuals recover more quickly as well. We'd like to add some more childhood prevention and early intervention strategies to help avoid problems earlier. One of the things that we continue to need in the community is medical detox. That was not funded in the most recent legislature, even though we had an ask in. And then we'd like to make sure that we've got a coordinated, aligned effort, and when we're looking at local, state, and federal funding, that we're utilizing it in the most efficient way possible, and that we're not duplicating efforts or introducing waste into the system as well. So if we were to add a community collaborator position, one of their responsibilities would be to coordinate these meetings, and amongst the different collaborative efforts that are going on, kind of create a super user group that would help lead the efforts. There's a number of different specialty work groups that meet, and we would continue to encourage that to go on, but we'd want someone that could collaborate, could convene those meetings and facilitate regular meetings and make sure that all the stakeholders were at the table at the time. You need to have the medical community involved. You need to have schools involved. You need to have the courts involved. Law enforcement plays a big part in this, and then there's the whole behavioral health service provider network that needs to be involved and working in concert to make sure that we get the best results for the systems and for the individuals. And then and then they would also identify gaps in the continuum of care and then work on identifying the appropriate responses to those gaps and making sure that there wasn't duplication or overlap in the system. We'd want that person to identify best practices and assist in implementing strategies, and that is important because if you've got one person that understands all of the systems together and knows what's going on, they're better able to tell their story to potential funders and to make sure that the funders are assured that the resources are being used in the best way possible. And to do that, one of the things this position would do would be to work with WSU to make sure that we had outcome and evaluation measures, because that's really what drives funding. The San Antonio model, in part, is incredibly successful for a number of different reasons. One, they got a lot of startup money. That's not going to happen here. But the other is that they do a lot of outcome measures, and they're able to demonstrate to funders the impact that they're having on systems and on individuals, much like we've shown with that cost-saving study that we've already done. But that type of measurement is really important in ongoing, in attracting and retaining ongoing funding. We would also want this person to help focus on tracking and making sure that the community understands the value that this system brings, because if you have attention applied to this particular thing, you're going to have support as well. Need to make sure that they're tracking different things that are going on at the state, local, and federal level. One of the things that we're going to be talking to you in the next few weeks about is what the legislature has done with the State Board of Ed budget in terms of behavioral health services in the school. That's an example of one of those other systems that needs to be engaged and will be engaged here in the local community very soon with some significant funding. But we need to have a collaborative approach to all of that service delivery as well. Again, it's about coordination and collaboration and making sure that stakeholders are involved and that they're engaged and that we're not leaving anyone out, and that we're tracking the activities that are going on so that we can apply for and receive funding to continue to make this stuff work. And so in terms of opioids, they would be able to work on public awareness and make sure that the community understood the significance of the problem and coordinate efforts with an additional position that we may talk about a little bit later. But there are two different issues, two separate and distinct issues, or maybe separate and distinct issues. And so this position would be able to be a bridge between that system and the behavioral health system, and that's the value that we could bring from that particular position. We know from the cost avoidance study that the Community Crisis Center and that model works, and we will continue to implement that. There are more savings available, I think, if we expand those services. We know that individuals that are very complex and they're high utilizers of all of the different systems, they have a lot of different needs that aren't traditional hospital or mental health services. Their housing, their transportation, they don't have social support systems, and so those are the types of things that we need to continue to work on to make those folks be successful in the community and not be constantly banging on the service systems and the care systems, because you get to a care fatigue point for some individuals. But we also know that consistent, intense engagement is necessary with this population. We value the San Antonio model. It helps focus our vision, but we need to craft our own model and move it forward. And there's a lot of different people in the community, a number of different stakeholders that are interested in making that happen. And this is not going to just benefit the community. It'll benefit individuals as well. But in the long run, having this particular position, we believe, would strengthen the system that we've got in place and help it continue to improve. That's the community collaborator position. I've got folks from the community here. If you've got questions, I'll take a shot at them, but we've got folks that are willing to help as well. One of the things that I'll point out is that the jail, or that the sheriff has got a grant application that is ready to come before you that could potentially be a funding source for this particular position, at least for a couple of years. And so he may be able to say more about that as well. What kind of questions do you have?
We have questions from the commission. Commissioner Unruh.
Thank you, Mr. Chairman. Well, Tim, I appreciate your presentation, and I am supportive of this initiative. I think that it is going to be important if we want to continue the success we've had in this through our Community Crisis Center. And one of the main arguments for going ahead and advancing this position is just the fact that we've got our partners all identified, and we're all on the same page and have a common goal of trying to address the needs of this population and but all the people involved are busy with the jobs that they have, and this is an additional burden, an additional organizational piece that I think we need to support if we want to go to the next level.
You raised two important points, and one of them is that there is a tremendous amount of momentum right now around this particular issue. The community has gathered and is responding to this, and so we have made some significant progress over the last few years. But you're right, everybody that works on this project, everybody that's involved in one of those collaboration efforts has another job. They may be the sheriff, and he's got some other responsibilities besides this one. Joan's involved. We've got folks from Via Christi. We've got folks from SAC. We've got Pastor Dave here. Lots of different people are helping push this forward, but they've all got their own work to do as well. And so this would be an additional resource to kind of coordinate and collaborate and focus on this effort full time to make sure that it that we don't lose the momentum that we've got going right now.
Well, we're not just hanging our hat on the model down in Bexar County in San Antonio. I mean, that's a great example, and they've had great success. They had significant private support to get where they are now, but we know, one, from our own experience at the Community Crisis Center, how effective this can be, but there are other models across the United States that are a little more advanced than we are. Is that not true, that show success in doing this? That
is correct. And so one of the important things that a person in this role could do is continue to research different models and do a best of breed type implementation here in our community, make sure that what we're doing is the most effective for our particular set of circumstances. We don't have one, I don't know if it's a mile square compound like they do in San Antonio. We just don't have that right now. But there are ways to implement the effective treatments and techniques in a scattered site approach, which is what we've done so far. But you're right, there are other systems out there that are having success as well, and we'd like to learn from all of them and implement what's working best here.
Well, I think that's important that we consider our unique opportunities and our unique challenges for our population, because I don't think everything's exactly the same as everything else. So we need someone who can help us understand that and advance it. The potential grant that we have coming to us, you'd indicated that would probably sustain us for a couple of years, but I think we need to to have the opinion that if we advance this proposal, that this is going to be an investment, a budget consideration going forward. I mean, we're not going to be able to just do this without impact, but in my opinion, it's clearly cost effective and will save us a lot of money at various levels. And so in light of that, just in terms of not only serving that population, but offloading some of the pressures on the service providers is clearly an important goal. So I appreciate your presentation. That's all I have.
Thank you. Commissioner Ranzo?
If this grant doesn't go through, talk to me about the funding. Will any of this be paid? I mean, will our partners help pay for this position?
There are, I think, probably 2 or 3 different alternatives for funding. One would be the grant that the sheriff has presented. We're also we have had conversations with the Kansas Health Foundation about their ability to help either fully or partially fund this for short term, maybe to get us started. Those are the 2 funding ideas that we've looked at right now outside of adding the decision package that we were going to propose.
Well, Tim, I appreciate the feedback that you've given us on this. I know that the sheriff's been working on a grant. That's one way that we can fund this, and hopefully that comes through. If we are not able to get the grant, I still think that it's important enough that we need to make sure that we find a way that we can fund this, either through public-private partnership or some other avenues that we have. Several of us have been down to San Antonio and seen the model that they have there, and it's a possibility. One of the concerns that I've got, though, is long-term. This position that you've described has got a whole lot of things on their plate. But one of the things that we need a person for is to go out and find the funding that we need to put together the programs that we could put something together like San Antonio on a smaller scale possibly, or some other city that's done something. And I don't know that this person, I don't think it's going to be just one person, because you're going to have somebody that can manage all of this and work with all the different organizations, and you're going to need someone else that's going out trying to find the funding, such as I think it was Valero, wasn't it, down in San Antonio. We need the person that can put that together too, and I don't know it's the same person. I don't know that one person can do all that.
I think we'll find that out as we go, but one of the options that we have is to coordinate with ComCare Community Partners and their commitment to fundraising. And so I think the real value that you get from a coordinator position like this is to pay a heavy focus on data collection and results, because that's what funders are looking for. And so if we've got somebody that's able to focus primarily on results and making sure that we're getting the results and we're documenting the results, and that we can demonstrate to SAMHSA and other funders that this is a successful program, success generates additional funding. And so if we have, if we're able to demonstrate success, and then we've got maybe a partner with ComCare Community Partners, or this position is able to work on some federal grants, or work with, right now we've got the sheriff's staff doing a lot of work on a grant application. There's lots of folks in the county that do grant applications. The most important thing for a grant application is if you've got some measures that you can include to demonstrate that you've either got a problem or that you've figured out a way to work on that problem and have had some success. So I think there's opportunities to coordinate within the organization as well for some of that fundraising.
Okay, thank you. Sheriff, did you have a comment?
Yeah, if you don't mind. Real quick, two things. I think the opioid, methamphetamine issue and the mental health issue are two distinct different issues, but they are intertwined. The community stakeholders that we have here today, if you don't mind if I introduce them to you, is Mike Rellin, Jeff Joffrey, and Julie Hauer from the Crime Commission. We have LaBonta Williams, former city council member and also a community volunteer now. Captain Dan East from the Wichita Police Department, Adrian Muntz from our Sedgwick County Health Department, and Reverend Dave Fulton from Safe Streets Wichita. And so what they're really here for is the opioid part of this. So there's two different groups. The first group was started in 16, which was the mental health group, because of all of the issues that we were having. The overload of the system, Osawatomie, blah, blah, blah. We've talked about a lot of those things. That has now transformed into the group that Tim is talking about, where we've done some things up at the state legislature. We toured San Antonio, and then this is the next step of trying to look at our numbers. We're gathering numbers right now, both mental health care and the opioid stuff. The grant, which will come in front of you tomorrow, Colonel Dietzman is meeting with Marty Hughes right now to finalize it. You should have a finalized copy, I think, by tomorrow morning to take a look at. What that grant would entail is possibly funding that one position, which would be the mental health collaborative, for 2 years, if we're able to obtain that grant, plus do all of the numbers gathering, all those other type of things that we're trying to do right now, but it's taken a little bit to get that done and coordinated. The second piece of that, and that's the reason why the Crime Commission is here, I've been speaking with the Crime Commission about possibly funding a position to do the same thing with the opioid and methamphetamine abuse issue that we have going on. I want to make it very clear, methamphetamine is what's driving most of our crime in this county. Opioids is going up, but it's methamphetamine. So when we talk about opioids, I'm including both. And at that point, if the Crime Commission is so gracious to be able to fund a position like that, that would be a total separate group that would be working on those two particular items, but intertwined with mental health care, because we know from methamphetamine abuse that we're seeing more folks that are emulating mental health care because of their methamphetamine addiction. So it is two separate groups. I agree that there needs to be two people, but I think that those groups need to be separated as well, especially since the Crime Commission is gracious enough to talk about possibly funding that position.
Thank you. Commissioner Howell.
I guess I will take a question. Thank you, Mr. Chairman. Just wanted to have someone remind me the dollar side of this thing. The grant is for about how much money, and when do we expect to hear back?
The grant will range between $200,000. We're a big enough entity, the city and the county is, to qualify for up to $500,000. That doesn't mean you'll get $500,000. The least amount you'll get is $200,000, and so it's got to be submitted by May this Friday, and at that point we sit and wait until they tell us whether we got it or not.
And if we get awarded that grant, that would be for 2 years?
2 years.
Okay. And any idea whether the Kansas Health Foundation is giving us a number they would be willing to support, and for how long?
We haven't gotten that far in that conversation with them.
All right, that's all my questions. Thank you, Mr. Chairman.
Thank you. Commissioner Enru.
Thank you, Mr. Chairman. Just want to make a comment about my perspective on this. I think that these two positions are critical enough for us to do an appropriate job of responding to the need from the substance abuse on one side and from the mental health issue on the other, and dual disorders. Whether those grants are successful or not, and whether our friends in the Crime Commission are able to support us after they've gone through their process, either what we need to take the positive step to get ahead of this issue right now. I think it's big enough in our community that whether these come through or not, we need to provide for them. If our community partners and we can get grants come through, that's terrific. But either way, I think we need to plan for them. That's all I have, Mr. Chair.
Thank you. Commissioner Howell.
Thank you, Mr. Chairman. I had a follow-up question, I guess. There was a while, I guess a year ago, we talked about longer-term funding for the Community Crisis Center from the state. Is there an update on that? We were, I think, asking for, $3 million.
We have received $1.3 million per year for a couple of years. We did get in the budget for 2019 for $1.5 million, and it looks like we'll be in there now as a regular recurring budget line item.
Around 1.5?
Mm-hmm.
Well, we asked for 3. Is that about right? No?
No. This year we asked for the 1.5 plus $800,000 to $900,000 for medical detox. That part did not get funded.
Well, again, so a year ago, former governor vetoed the vending machine lottery bill. That was supposed to be a funding source for things like this. Now this governor just signed that, I understand. So does that mean there's new dollars that will be funneled into this type of stuff? Do we know?
We believe that there will be, but we don't have any idea right now how much there will be total and how that will be allocated, because right now there are 4 community crisis centers across the state. Ideally, every CMHC or most of them would have them, and so it's unclear if they would spend that lottery money on supporting existing crisis centers or helping communities start new ones.
Okay, well, I guess we ought to just, I don't know how we do this, but we ought to keep our eye on the ball and track those dollars and find out what the state plans to do with that, because that might become a longer-term source of funding for a community crisis center and or something like this. So, all right, thank you, Mr. Chairman.
Thank you. Well, I don't see any other questions right now, but I would just want to make sure that everybody understands that I am definitely supportive of the grant that the sheriff is going for. I do think we're probably going to need at least 2 people to do both sides of this. We've really got 3 problems that I can see that we can address. One is the drug crisis, one is the mental health crisis, but we also, both of those kind of contribute to the homeless issue also. So there's 3 different areas that are all interrelated. The other thing I want to make sure everybody understands is that we sincerely appreciate the partnership between the hospitals, the Crime Commission, everyone else that's involved in the community, because we're going to have to work together as a community to figure out what the solution is to all of this. Thank you. Anyone else have anything that they'd like to say at this time?
I may have just a comment, if that's okay. I'm sorry, one more thing.
Let me
That's fine. Let's go ahead.
Reverend?
Commissioners, I'd just like to speak in support of this proposition. A couple of weeks ago, I was at the National Prescription Drug and Heroin Conference, where Kellyanne Conway and Bill Clinton spoke on the same day, and we're in total agreement on the opioid crisis. I'm from the state of Washington. To me, it's like a forest fire that's coming. You can see the change in the sky. You can see, smell the smoke, and it's coming. It's a national problem. We are fully into methamphetamine crisis as we speak. So somebody needs to take leadership in the public realm around substance abuse. It seems like the county is moving in that direction, and God bless you for that. It is last year there were 67,000 overdose deaths in the United States due to substance abuse, due to opioids and other drugs. 67,000. That's 15,000 more than were killed in the Vietnam War over a period of 12 years. So it's a matter of we either focus on it now and get ahead of the power curve of the opioid crisis, or we will be like many communities in the United States that are suffering to deal with the after effects of it. I think the collaborative position will be a way to draw more community partners into it. In a way, prevention is kind of what I'm all about. And prevention doesn't take a special skill set. It just takes a determination to have the kind of community that we all desire, where it's well for everyone. But I think public officials need to take that leadership role of advocating for prevention. And I think that faith communities can be really deeply involved in this. The business community, it's there. Many substance abuse people are employed. Most are. And so it's in the interest of the business community to step forward also. So I'm very excited about this initiative. I'm glad that the mayor invited us to the table, and I pray that you will do well and consider this seriously. Thank you.
Thank you, sir. Appreciate it. Commissioner Howell?
Thank you, Mr. Chairman. I just wanted to update one of these slides here. It says on page 5, it says that medical detox does not exist in our community. I would just like to point out that it was last Thursday, Mayor Longwell and myself, and I think everybody was invited, but at least the two of us did show up, and we celebrated a ribbon cutting of a new facility called Fieldview at Holland. They have 64 beds. And I may not get the breakdown of this right, but I think around 16 of those beds are detox beds. It's medically supervised. Dr. Greg Lakin is a doctor that provides services. They have nurses on staff. They provide medical assistance, medicine to help them get through the detox, and they provide up to 28 days per client to provide better habits, I guess, in getting off their substance abuse issues. And so they did make a comment that the problem of substance abuse is increasing in the community. They say right now about 1 out of every 12 people have substance abuse problems. And so this is a new model for Wichita. They think they're going to be successful and they're going to be filled, but it's just opened up brand new last Thursday. So with the addition of 64 beds out there and a very robust staff, and including medical staff, even doctors. And so I want to just make sure that you guys are aware of that, and it's all private sector, so I really appreciate what they're doing, and I think that ought to be part of our coordinated solution, is at least be aware that is happening. So
that's a good reminder. Thank you, and they're a welcome addition to the community.
Very much. Thank you so much for allowing me to update that slide. Thank you, Mr. Chairman.
Thank you. And again, I think we still have some folks in the audience who'd like to speak. Please approach the podium.
Good morning, Mike Relihan. I'm on the Wichita Crime Commission's Executive Board. A couple of years ago, we started asking ourselves, you see the crime of the week things that keep showing up we put out our little thing every week, and we have some guy kicking in the back door, breaking in, trying to steal something. So we have a nice video of a guy, and sometimes we catch him and sometimes we don't. But we started asking ourselves, why are these people kicking the doors in? And the reality is that most of them are kicking the doors in to get more meth, primarily right now. And so we said, what can we do different? So as a crime commission, we started talking among ourselves about we need to start ramping up some things, and we weren't seeing much happening, and we've been talking among ourselves. Now we're seeing that the community's coming together. We talked about earlier, I think the comment was that we're starting to get some momentum and do some things, but I think that the folks that are out on the street will tell you we're losing ground. We're going backwards. We had the chief of police from Concordia, Kansas, was in my range a couple weeks ago. Since the first of the year, they've had 3 fentanyl overdoses in Concordia, Kansas. So things are coming this way. We talk about deaths and those kind of things that are happening. It's not just deaths. One of the things I do is deal with families and their investments, and I've seen a family destroy all their savings, all their retirement savings, to try to treat their son, who ultimately ended up overdosing. So it's not just the deaths, but it's there's a lot of families being destroyed and doing things. We're all fortunate. We're not out on the streets and we're not really seeing what's going on out there. But I can tell you, people that come into my business are buying firearms because they're scared of things that are happening in the community, and I would rather that they not be doing it for that purpose. We need to get a sense of urgency on this thing, because if the longer we wait, we can submit our grant application, and that's great. But you all have an ability to, with I think the largest budget in the area, to make an impact, and to decide you want to do this, and make that investment. I mean, this is an investment in a whole lot of things, in jail space, and police. Think about the police resources in the sheriff's office that we wouldn't need if they weren't out arresting folks trying to break in and creating the property crimes all the time. So these two investments, these positions in the crime commission, we're willing to help fund one. We think we can go out and probably fundraise in the community in a different way than you guys can. But it's an important thing. I mean, it's an economic development thing. We have a lot of the manufacturing in this community is dealing with drug issues in their employee population. I think it was mentioned that a lot of the folks that are need treatment are employed. Well, they are, and so we need to be paying attention to those. But again, I would just try to urge you to get a sense of urgency on this thing, because we're not gaining on it at this point. We're going backwards still from everything that we can see, and everything that I think the people that professionally deal with folks, we're maybe starting to turn it around a little bit, but we've got to get going, and I think you guys are probably the ones that can really take that ball and get it moving. But we'll help. We'll do whatever we can.
Thank you, sir. Anyone else in the audience wants to speak? Rusty?
So,
Mr. Chairman, Commissioners, Rusty Leeds, Assistant County Manager. So on the substance use issue, opioids and methamphetamine, the sheriff has taken the lead on this. As you're aware, you were at the meeting at the Extension office where he kind of did the groundbreaking meeting with community stakeholders on this thing. During the course of that meeting, the Crime Commission graciously offered to perhaps work toward funding a position as a community coordinator to help pull together resources in the community to find those substance abuse centers that currently may not be as involved with the population that we deal with through the 911 system, through the jails, through the EMS system. So they've offered to help fund. During the course of that meeting, Mr. Chairman, you indicated that you thought that the county government might have some role in that position as well. So to that end, we developed a very rough draft position within the county, understanding that we have no funding source except for county general fund dollars at this point. unless the Crime Commission is able to take the lead and provide that position. Kind of as we move forward here, just for clarification's sake, the position that we recommended as a rough draft for a position within the county was a position that would do all the things we've talked about. They would help to coordinate community resources. They would help to work with law enforcement. If we developed a program where law enforcement was a community source to help people who were seeking a way out, this coordinator would help coordinate that law enforcement effort. They would help coordinate with local medical resources, hospitals, the medical society, with ComCare and the health department, with local substance abuse centers, and also look for funding sources through grants. They would be a grant search and a grant writer. And that position would be housed technically under the county manager's office, but under the purview of the medical director is what we were proposing. The medical director, Dr. Gallagher, as you're aware, has access to all of those medical resources that are relevant to substance use disorders. They currently have a program that is active that helps. They've developed a network of resources to work with those system users who are not best served through the 911 system. They're best served through other resources. They've developed a links program where they are able to get those people directly connected to the resources they need to get the help they need. Where we're kind of lacking in this community is substance use resources that provide service to those underinsured and uninsured within the community. We have lots of resources that take those who are insured, have a pay source, but we lack those that can manage the populations that need the help the most, those who don't have insurance or are underinsured. So as we move forward, for your consideration and perhaps for you to give us some guidance, is if you're interested more in working with the Crime Commission and what they can provide, or if you want to look more deeply at what the position within the county, funded by the county, would look like, with the understanding at this time we don't have a grant application out and we don't have another identified funding source except for the general fund dollars. So,
thank you, Rusty. Again, I think that this cuts across Sedgwick County pretty heavily, with our ComCare folks that are deeply involved in it, with our health department that's deeply involved in it, with our sheriff's department that's deeply involved, with our EMS, fire, just about everything that we do is somehow impacted by this situation. So if the Crime Commission can help us out, I think that's fantastic, because if we can get a partnership, that would work great. But I still think Sedgwick County has a huge stake in this, and Sedgwick County needs to take maybe not the lead. If there's someone else that would like to take the lead, that's fine. I don't have a problem with that. But we definitely have a big role to play. Commissioner Unruh?
Thank you, Mr. Chairman. Mr. Manager or Tim or whoever, what do we need to do to have this commission give you the approval to get started on it? I'm not content to wait for next year's budget recommendation and then start a process, or wait till next year. And I don't know how, if we get started ahead of grant applications, if that interferes with the process, but somehow I would like for you to get us to the point where we say yay or nay, and I think that I think we should do that sooner rather than later, and then, because of the importance of this, and then we'll just leave it up to our senior staff to figure out how we work out the details of paying and getting it in the budget. But we need to drive the stake in the ground now and say, we think it's important, it pays off, and it's going to help people. So we need to get moving with it. So whatever you need to do to get us to that point, and we can say yes or no. But I don't want to wait till the end of the budget season.
Well, I think the method of that is allocating the positions in the recommended 2019 budget, and then work towards, if the commission approves that, then work towards as rapidly as we can to define it, roles, responsibilities, duties of these particular people, where they will reside, the whole 9 yards. Would have a lot of work to do before it before the 2019 calendar year gets here. So it's basically presented for the 2019 budget. Is how we do it.
Well, and I appreciate that. I just am encouraging you to start the process of figuring out who, what, when, and where, and then if we have to say okay in the 19 budget so that we're ready to launch sooner than later.
There is a lot of discussion. We've talked about this a lot in the last month, but it's a relatively new topic. But there are a lot of discussions that we've had. Private partner, public-private partnership, where this person would reside or where these people would reside. Is it county manager truly the best place for that? Is it assigned to our partners, like ComCare Community Partners, let them, be the conduit to get to at least the behavioral health? Where is the appropriate place for these people? And I think that's going to drive the discussion of how we finance it or if we finance it. So there is still a lot to work out with it. So, to get it going though, is to present it in the 2019 budget and let the commission vote on it if that's what you want.
So we won't make a definite decision until August.
Well, no, not necessarily. I'll present it in my in the county manager's budget, but the final decision will be at that budget adoption in August. Correct. And then the next 60 days, we'll just try to develop it as best we can to prepare it for that vote. And maybe even have to come back in for another budget workshop before that, just to explain it, let you know what the grant outcome was, and give you a little more clarity on these two particular positions. But the final vote would be that August budget adoption, BOCC budget adoption.
Okay, well, I guess I've expressed the fact that I'm impatient and think it's something we need to get going on as quickly as possible. So, and I don't want to tell you how to manage the structure of it, but we clearly need to invest in it, if no other reason than it saves us a lot of money, besides the fact that it helps the community and it helps those individuals.
Sir, may I ask if any of our other community stakeholders here have thoughts on where this position should rest? Should it be a private sector position, a government position, or do you have an opinion on it? If anybody wants to speak to that while we're here today?
Vaughn Williams, welcome.
If that's all right, sir.
Thank you, and good morning, Commissioners. Some of you may be asking, why is she here? Well, 2 years ago, I was a part of a national team that looked at the problems of opioid and meth. There were 10 from the city government, and there were 10 from NACO. And we went to some of these communities that are actually really, really struggling. And for me, it was to say, I never want to see Wichita in that position. As we went into the jail pods, there were 12-step programs. And to watch those young men and women try to come out of that jail pod in a positive position and a community-involved person was overwhelming. To watch them join arms and to hug it out in a way to say, we're all in this together. To go to a health facility and watch people start lining up at 6 o'clock in order to receive some type of a drug overdose prevention medication. To watch people line up at 6 o'clock to receive that medication was overwhelming for me. Those are things I never want to see in the city of Wichita and the county of Sedgwick. That is so important that we be very, very proactive as opposed to later on being reactive. I'm with you, Commissioner Unruh. I'm saying, what do we do and how soon can we start that? We started looking at the data. Once you see some of the data, and I think that Adrian has been collecting that and working on that, once you see some of the data showing that we are steadily increasing, you will be ready to get on the same train that we're on, to say enough is enough, and that we have to be looking at this. As I was traveling with this national team to see young people that are affected by it, because that's my focus as well, young people and kids affected by the same thing. To see in the newspaper every single day another overdose. And this was in Ohio and Kentucky, were a couple of the places that we were to see some of these situations. So I am also saying, let's definitely look at a way that we can move this forward. Let's look at a way to see if our city partners can be involved. Let's look at a way to say that Wichita will be proactive, that we will not be reactive to some of the things that are going on across the country. Let's look at a way to fund a position, but let's not let that funding of a position stand in our way of protecting our community. That's very important. Let's look at a way to make sure that our young people don't have to be put in another foster care system because the parents don't know how to react and don't know how to take care of themselves when it comes to drugs. We've had 4 children at least, and maybe more, that have been killed, and in most of those cases I think drugs have been a part of that activity. So let's be proactive. As far as looking at a government agency or how this can work, I think it's up to us as a government with the collaborative partners of the community. But it's up to us as government officials to make those decisions. Thank you.
Thank you, Ms. Williams. Sir.
Just one more quick comment. One of the things that the Crime Commission is doing is we're looking at sometime in October trying to pull together a community summit, do kind of a real big deal, bring in all the media, bring in all the stakeholders, in one spot, maybe up at the Hughes Complex at Wichita State. Bring in some speakers. We got some great local speakers. We got some, maybe some national people we can bring in, but maybe have that be kind of a, if you will, a public kickoff of this is kind of a community-wide campaign. So that's something that we're working on right now. We'll keep you up to date on that, how it's going. But I think it might be a good thing as we kind of all move towards that kind of be a big bell ringing type of thing in the fall, and you can kind of be getting your things together, and we'll be doing the same thing, just to kind of maybe kick something off. Does that make sense? Does that sound like something that might work out? Okay.
Sounds good. One question for you, sir. Excuse me, sir.
Yeah.
I know when we were at the Extension Center, you indicated that you might be able to start funding a position or partially funding a position. Could you do that sooner rather than later?
We would certainly look at we've got a board to deal with too, but I think we're convinced that we need to be able to try, and we think we've got some capabilities probably that they're outside from a fundraising standpoint that we can do things that the county can't necessarily do. So we'd sure I think really want to try and do that. And if you go to the business community and say, look, this is what we're wanting to do in this spot, and this is an investment in your community. There's businesses in this community I think that'll support that.
Super. Well, I appreciate that. We've just heard that we may not get it into our budget until 2019, and Commissioner Unruh is impatient right now.
Sheriff Eastern down a couple of detention deputies, maybe just kind of move some money over.
I think the sheriff might have something to say. Reverend.
Commissioners, Einstein said that you can't solve a problem with the same thinking that created it. And so I advocate for the Crime Commission as a partner in this. What happens is we create new collaborative relationships, and there'd be tremendous collateral benefit to the whole community, focusing on the issue of substance abuse and substance abuse prevention. Just to note, substance abuse has 3 pieces. It has prevention, intervention, and recovery. The best people to do prevention are people who are in recovery. And so intervention, though, is where most of the money is required, and also the professional expertise. Anybody can do prevention, and so you as government leaders need to be advocates for prevention to get that word out across the community. So again, I think we're on a roll. And as an organizer, I always have a sense of urgency.
Thank you. Carl?
Good morning, Commission. Malachi Winters, Program Manager with the Office of the Medical Director, Dr. Gallagher's office. I just wanted to speak for just a minute to make sure that you guys are aware of our current situation and the work that we're having to do, because this is all work that we're stuck with, whether we want to or not, and we're forced to already start addressing these issues. As everybody that calls 911 becomes a patient of Dr. Gallagher's if they call for a medical complaint. So anybody that the fire department responds to or EMS responds to are considered one of Dr. Gallagher's patients. We are dealing with, the issues that every system across the country is dealing with recidivistic repeat callers. Oftentimes, substance abuse is one of the main reasons for that. And so having to kind of piece together without the staff to do it, one of the solutions that we've come up with is a collaborative with Wichita State University and Newman University with their social work programs. Allows us to take a practicum student underneath us that can help out with addressing these issues. It's been a pretty successful endeavor. We've seen 174 patients over the last calendar year with our last practicum student. The problem is, though, that it's not a full-time position. It's a half-time unpaid position that's, dependent on whether or not there's a student that's willing to come and deal with that. But with that, we've started to make inroads. We're having monthly meetings with representatives from both hospitals where we will deal with our shared clientele that are the most problematic as far as repeat users for that month. Vast majority of those are alcohol and methamphetamine. This is something that we've established, we've seen good results from. I think that having that relationship with the medical society, with Dr. Gallagher, and having that relationship with other physicians in the hospital has streamlined some of those efforts. And for your consideration, I just wanted to present that to you and answer any questions that you have as far as placing that position within the Office of the Medical Director.
Cooper. Any questions?
I have a couple of points on the funding of the position. So we're in the process of doing the grant application. It's going to take a couple of months, 2 or 3 months, that if we, for instance, if you're wanting to fund it right now and we use contingency to do that, either operating or even public safety contingency, to be able to fund a position right now. That would mess up the grant application process. So if we let the grant application process work itself out for the next 2 or 3 months, we can bring it up for that August budget adoption, and probably by then we could have a result. But let us work through that piece of it. In terms of timeline, do we put it in the 2019 budget? Do we wait? Either way, we've heard you. Let us track it, and we'll figure out the best timing to get that in front of the commission for a vote.
Okay. Commissioner Ranzo.
Yeah, I don't know, a year or two ago, we came up with this public-private partnership with ComCare, the entity that was going to help raise private sector dollars. I mean, is that something we're looking, that's something I think we should look at. I don't know what the status is, how productive they've been, but this seems to me that exactly the sort of types of things that it was created to do. So I think we need to take a look at that as well.
Thank you. Other comments? Any other comments from anyone in the audience? Sheriff.
Sorry to prolong this. I was talking to Mr. Rellin. From a standpoint of where the opioid particular position would be housed, they don't care where it's housed at. So if we wanted to house that position with the medical director, that might be the best place to put that particular position, but would absolutely have to work with all of the partners. And so when we're talking about the grant position, that's only the mental health care aspect of it. The opioid position is something that we could possibly use some funds to get that started right now while they're going through their process of trying to raise funds. If that answers your question earlier of where it should be placed. Yes, sir.
Ranzo.
Just to clarify, I guess I'm confused on that grant application. I thought it was also going to do some data gather with respect to opioids and methamphetamines? Did I
It can
miss-
gather data. We can gather some data on it from the grant position, but from the opioid thing, when we're talking about programs and everything else that we're wanting to do, that's not what that grant money can go towards. It has to go towards the mental health aspect.
Anything else? Anyone else want to say anything? Okay. Well, again, I appreciate everyone from the community that's here today. I think the commission has heard your concerns. I think a number of us share your concerns that you've got. I think the manager now has some direction on which way to go. And hopefully, with you all's effort and the effort of our staff, we can start moving forward on this. Again, I appreciate everyone coming. I share your concern. Thank you. Mr. Manager,
All right, so we'll take 5 minutes, and then we'll set up for the sheriff.
we can take 5 minutes. Thank you. All right,
what you're
Mr.
talking
Manager. I think we're about ready.
All right. All right, Commissioners, next topic. Over the last couple of years, the sheriff and I and his staff and my staff have been working on the potential for a new sheriff pay proposal on how he, in the sheriff's office, pays his deputies. And so we came up with a proposal, and the sheriff and his team are going to brief that to you now. And I'd love to hear your comments on this plan. The sheriff's office, obviously, in terms of recruiting, especially in the detention deputies, continuing to face, it's almost at crisis level, and trying to get people to want to come in and fill those positions. And also the disparity between how we pay and how the WPD pays, and how we are sending deputies to training and they end up being WPD police officers in the end. There's a lot of things that we would like to do in terms of trying to put us on an even playing field, even though it's not at all possible, but we can sure make inroads to get us closer to that, to help the sheriff out. And this is a collection of about a 2-year effort, as I said earlier. And at this time, if sheriff's office could hop up there and
Morning, Sheriff. Once
kick us
again.
off.
Good morning. I appreciate you listening to us today. One thing that I wanted to start off with, and then I'll introduce Captain Mattingly and Deputy Monroe, who did the majority of work on this. If you remember last year, we came to you and where we did a comparison strictly to the Wichita Police Department on pay. And what we found was the comparisons starting out as a recruit. And again, I want to reiterate, these are last year numbers. It's more than that now because they've renegotiated a contract. But even from a recruit level, their pay was 5% more up to 15 years. They were 20% more at the deputy comparison. At the detective comparison, it was from a first-year detective 18% up to 25% as a 15-year detective. As a sergeant comparison, they started out at 18%. I'm sorry, let me backtrack a little bit. That's total compensation because of longevity and education pay. Base salary, sergeants were 15% higher than our sergeants were, along with up to a 15-year sergeant was 20% higher. So I just wanted to remind you of those numbers that we discovered last year when we did our comparisons. This year, what we're going to talk to you about is the steps and ranges proposal in reference to 10 steps at 5% each. And this also includes detention deputies, not just commissioned. We can't really compare our detention deputies because of the state pays differently than we do. When we compare ourselves to Johnson County, which we have a lot more deputies working in the jail and a lot more bed space. They're all commissioned, so we can't compare ourselves to them either. One thing that I do want to point out, though, is, and this isn't all based on pay, I want to make that very clear, in the way law enforcement has gone, probably about the last 6 or 7 years, as you know, in the national media and those type of things, we have a lot less people that want to be in law enforcement, plain and simple. And if we have a lot less people wanting to be commissioned deputies or police officers, we have a lot less people that want to be in detention, because most folks that join detention, about 90-95% of them, want to be on the road or be Wichita police officers. So that contributes to it as well. But also the pay contributes as well. We have a recruit that's in the detention academy right now who's just accepted a job with Wichita Police Department. So we're training a guy who will never work here. And asked him, well, you know, why are you going there? You're in the application process for the SO to be in the road. And his answer was it came down to pay. He wanted to be paid more. Right now, we usually get about 300 applicants for positions within the commissioned deputy positions. We're going to have 12 in the upcoming class in August, and we currently only have 25 applications for 12 positions. 4 of those 25 are current detention deputies that are on the job now. 10 are in this academy class of 21. If I have to take all 10 of them, plus this one's leaving to the PD, that means I'm only going to be putting 10 in the jail of the 21 we hired. Detention applications, we got 6. That's a huge problem, because currently we're down 64. You throw in the 21, we're down, 45, but then you take 11 of those and it makes it even worse again. So that's the predicament we've been in for about 2 years now, and it's been very serious for the last year. And so that's why we're asking to take a look at a new pay plan for the sheriff's office, and this is commission and detention only. It does not cover civilian personnel, to look at our base pay and put it back into a steps and ranges like it used to be several years ago. So I can take questions now, or if you want the presentation from Captain Mattingly on the other stuff that we have now compared ourselves to, I can stand for questions later.
Thank you. Do we have questions from the bench? I don't see any.
Good morning, Commissioners.
Good morning.
Captain Mattingly. I have only 5 slides for you, and then I have the completed range and step scale for you to look at. So first thing we need to do, as the manager said, we've been looking at this for about 2 years now. We've done a lot of data gathering, agency comparisons, looking at different pay plans. So I'm going to summarize everything that we've done. Our first scale we have, side-by-side comparison, the agencies we look specifically at. We have Johnson County, Wichita Police Department, El Paso County, which is in Colorado, Tulsa PD, Omaha Police Department, and Douglas County Police Department, also in Nebraska. This slide represents, by the blue bar, the minimum or starting salary of these agencies. The gold bar is how they top out, maximum salary. That's current Sedgwick County, and as you can see that we are starting below all of our competition, and we top out lower than all of our competition. That graph didn't tell me a whole lot. I wanted to dig a little bit deeper into what's going on, and we actually pulled their pay scales, and what we found is all the agencies except for the Wichita Police Department are using a 10-step range and step scale system. The police department uses a 15. So if we look at how these agencies, their officers, move through their pay plan over the years, you can see that Sedgwick County is down at the bottom. We're kind of a flat line. We took an average of 2.1%. That's about an average increase that we've had over the last 10 years. Whereas the other agencies are quite a bit more aggressive. You can see Douglas County and Omaha, they're topping out in 10 years, and you see how aggressive that looks, then they flatline. That was a lot more telling than that first graph. That was actual pay plans, and we have copies of those. I'd be happy to provide those to you. So we wanted to start looking at that. How are they moving those folks through their system? As the sheriff talked about, we do have an issue. The more I looked into this, the more staggering I found these numbers to be. We pulled this data out of iLeads. It's the Sheriff's Office database. Looking at the top part of that, in the last 10 years, regardless of date of hire, we have hired 415 detention deputies. 411 have left employment, regardless of hire dates, so someone could have hired on 30 years ago and left in the last 10 years. That does not include the folks that have gone from detention to the Law Enforcement Bureau. Then you can see our normal staffing table in detention is 300. That's almost a complete turnover of our employees within the detention facility over the last 10 years. Law enforcement side, in the last 10 years, we've hired 92 deputies, 76 have left employment. Our staffing table for law enforcement is 180. We currently have 10 in the academy, and we will have 12 openings the day they graduate, so we have to start another academy immediately. And as the sheriff indicated, we're having a difficult time finding applicants. In that same time frame of 10 years, we have gone from hiring pools of 300 applicants to hire 10 to 30. Currently, we're looking at a class of 12. There are under 30 applicants for that class. I drilled down a little bit further, looking at folks hired in the last 10 years and also left in the last 10 years. 246 detention deputies were hired in the last 10 years and also left. Their average service time was 2 years and 2 months. Out of 300 people, that's telling me that we've got under 50 people that remain in the last 10 years. Our proposal is a range and step implementation, and we're working within the confines of budget this year and next year. What we were able to do, the county intends to allocate funds to the sheriff's office in 2019 in a 4% total compensation pool. That is divided into two. A 2.5% compounding base pay of $817,947 and a 1.5% one-time bonus pool of $490,768. Our plan, in the chart you see at the bottom, using existing budget in November of this year, we will place all deputies on the closest step. If you're using a range and step, everybody's got to be on a step at some point. So using money this year of $112,214, we will place folks on the closest step. Then in 2019, assuming, and it's a big assumption, that everybody gets their step, because that is not the case. If their performance evaluation is not meeting our expectations, they will not get their step. They will not move up a step for an entire year. Assuming they all get it, which we know is not going to happen, it would cost $845,544.23. That exceeds the $817,947 allocated in a compounding base pay pool. We are proposing that we are asking for the difference of $27,597 to be taken from the 1.5 one-time bonus pool and moved to the compounding base pool, and then we will return the remaining $460,000 to the county, as we will not need it in 2019. If this proposal is accepted, this is what that chart looks like. We do not come out on top. However, we are far more competitive with our direct competitors: Douglas County, Omaha, Wichita Police Department, Johnson County. We're all fighting for the same folks. We're all fighting for those 27 applicants to fill 12 jobs. We believe this makes the sheriff's office far more competitive. Last, I want you have a hard copy of the actual range and step scale. It looks like that. It is a 10-step scale. Each step is 5% per Promotions through the rank of sergeant are 5%. Promotion to the rank of lieutenant from sergeant is 10%. Promotion to the rank of captain from lieutenant is 7.5%. The reason for the higher numbers for lieutenant and captain is we are having a difficult time getting folks to want to promote to lieutenant. The reason being, current top-out lieutenant pay is only $6,000 a year higher than a top-out sergeant. Lieutenants are salaried and do not get overtime. So sergeants, if they get some overtime, they can end up making more than the lieutenants. So we're asking to bump that up 10% for those pays. Working through this range and step scale, a person could, I stress could, top out as a captain in 18 years. More than likely, it will take 22 to 25 years. That's about the average for someone to progress through the range and step scale. With that, we stand for questions.
Thank you. I have questions from the bench. Commissioner Ronzell.
Yeah, a couple things. First of all, could you send me the whole presentation electronic?
Absolutely.
We got some of them, but we didn't get all of them.
Absolutely.
And so, do you have a written policy of how that I could read on how this would work? I mean, like you said, it'd take 20-some years to work through the steps. I mean, so one of my questions was, well, how long does each step take? Is that, I mean, how do you determine that?
We do have policy in place, Commissioner. For example, you cannot test for the rank of corporal or detective unless you've spent 3 years as a commissioned deputy or a detention deputy. Then once you make that, then you have to spend so many years in time and grade to move through the ranks.
So could you send that as well?
Yes, sir.
But the steps, is this like every year or what?
Yes. I'm glad you brought that up. I failed to mention that. The steps would be, if you get your satisfactory evaluation, your step will be given to you on your date of hire anniversary. Date of hire anniversary, not January 1. So it depends on what your hire date was. Law enforcement side, generally we will hire folks in July and January. So half the folks will have raises in January, the other half will be July. Detention, it could be anywhere during the year.
Okay, so I guess I'm going to need information from staff. I know it's revenue neutral 1 year, but what I need to know the cost going out, all that's cost going out there, and then what would happen? Okay, so you have these steps; they're 5%, and would those numbers stay the same?
Yes, sir.
But they wouldn't. When would they change? Or what would be the mechanism of? They wouldn't. Those numbers wouldn't change, or would they? If we gave people, everyone else in the county, a certain percentage. You understand what I'm saying? A raise of 2%. I mean, would these numbers go up 2%? They'd stay the same, and it would just be the
5% each step.
It would be 5% each step. Whatever you gave the rest of the county would not affect us.
Okay.
And the only other thing is that what got us in this predicament was the years of pay for performance and only boosting the recruit pay. And so we were upside down, completely upside down on recruit pay because that kept getting boosted over the last several years, and nothing was boosted above and beyond recruit pay. And so we had detention deputies that had been here for 2 years getting paid less than some of our recruits. Prior to most of you being here and any of the staff here, we had that discussion with Mr. Buchanan when I first came here 5 years ago on how this was very detrimental, and it still continued. And so that is part of the problem with pay for performance. That's part of the problem with only boosting the startup pay to try to get recruits in the door.
Okay. Well, I'd like to get some. I thought we had some retention numbers or some turnover rates in the past for the detention and the sheriff. I'd like to get those again. And I'd like to see more details of the things that you listed there, of why people left. I mean, how many were retirements, why they left. I understand the issue here. I also think we have to be careful. Sometimes we compare ourselves to other communities as far as pay when there's cost of living, there's work, operational tempo, the ability of the community to have their tax base, all that sort of stuff. So I want to look at everything there. It's multifactorial. I understand.
And I agree with that, Commissioner Ranzow. The fact of the matter is that's why we wanted to compare ourselves to the Wichita Police Department, because we are the same cost of living. And
Right.
you can see how much lower we are than them.
That's true.
And Omaha is close to Wichita, the closest comparison. El Paso County and Colorado Springs, their pay is way, way too high, in my opinion. Douglas County, which is the Sheriff's Department in Omaha, they were the closest we could find for a good comparison without all these outliers. So we didn't want to come in here with El Paso County and Colorado Springs when their pay is way, way over the top. And we're not asking to get paid more than these communities. We're asking to get paid relatively the same, a little bit less, but relatively the same.
Yeah, because we also have to just be careful comparing ourselves to the city of Wichita. We've had some discussion. I've talked to some people. I mean, the working environment is different. They're also to the point they have financial issues, and they can't afford to hire the number of police officers they actually need, which is a problem and affects the workload of everybody else, being told. So there's lots of things I want to take a look at. And I just need more information.
I guess I have a question about your proposal. It says using funds allocated to Sheriff's Office in 2019. Does that mean you're not asking for additional funds?
No, sir, we're not.
Okay. So all you're doing is aligning the funds that you're already
Yes.
in the 2019 budget.
Yes.
Okay. That was my only question. Commissioner Howell?
Thank you, Mr. Chairman. Just a quick question. The highlighted sections on the pay chart, what do the highlighted sections represent?
Those represent as close, some are higher, some are lower than existing maximum salaries.
Okay. All right, good. And I agree with Commissioner Ranz. I'd like to see some of that data again on some of our attrition information about, some of these folks may have been terminated, some of them retired. How many of them shifted from Sedgwick County to another department, whether it be Wichita or elsewhere? Do we have that? I hope we have that data. And then again, you went through it kind of quickly, but let me just hear again. So we have 12 graduating here in this current class, and we have another. How many openings after this class is placed?
In the law enforcement class, there are currently 10.
Okay.
Once they graduate, we will be 12 short, and we will be starting another academy in August if we can get 12 people.
Now, just to because I'm not sure this is true, but please tell me, because of the new law enforcement training center, there was a time we maybe didn't have a class because it was in the process of kind of anticipating the new LETC. Did we not have a class maybe when in the older facility when we maybe should have had one? Is this a consequence of that in any way?
No. No, we did not postpone starting any classes due to the transition.
Okay. And the shortfall, I think the sheriff said we have 64 positions opening.
Yes, sir.
Do we have a long-running position? We've been short for a long time. Do we have that total, like, over time? We can look at that and see how it's been over the last few years. I mean, I think this is. I mean, it's a big number, obviously, but
it's the highest
how far back that goes.
Right, it's the highest we've been. It seems like over the last 10 years, we were 20 short, seemed to be the number. Then it went to 40, and now it's at 60. But we can probably run those numbers down for you.
Okay, and this might be a question for Lindsay or maybe the manager. I'm not sure, but we did some pay adjustments to the sheriff's department last year for the current fiscal year, and I guess that would have started in January, the 1st of this year. Is that correct? Can you please remind me what we did there?
We actually started, if you remember, part of the 2017 budget development, we started the oppression and compression adjustments. Right. And that did take effect. As a matter of fact, this is what basically we use as a means to get to the pay scale step adjustment. As they went down to the name tag level and looked at every employee that the sheriff's office had, and made those adjustments. And we did it with the understanding that we needed to find that solution that would keep them from going back into having those oppression and compression issues.
What I'm trying to say though is we did make an intentional correction to the salary structure of the sheriff's office.
Correct.
Was that this January or was it a year ago?
That was for the 2017 budget.
I'm over here, the manager. That was for 2017. It did backdate to January. That was done for the entire county, but the sheriff's office was treated slightly differently, in that they really did go down to that name tag level to make sure that everything was in parity.
We have a little bit more than a year of data on the new pay structure. Maybe it wasn't enough, perhaps, but did we see any change in the trend data from that? We made an adjustment to how we pay sheriff's officers and detention deputies. Did we see some type of a bump in the data because of that?
Well, I want to be clear here. It was simply compression from all of those years of giving recruits extended pay and nobody above them getting more pay. This didn't affect the hiring of people or anything else. It was simply we had people that were underpaid compared to people that had 2 or 3 years less on than them. So this was simply a compression issue that we went in, and it didn't affect every deputy because not every deputy was compressed.
I understand that. I'm trying to say though, with that intentional trying to fix that pay compression, do we see maybe a lessening of people moving to WPD or other places as a consequence of that pay adjustment? Did that change the trends in any way?
No.
Okay. Are we seeing a lot of people from the SO office going to WPD right now? I mean, that has been a concern for a long time. I know I guess they just went through a contracts. They have a new contract, I understand.
Yeah, that's my understanding as well.
So,
no, I mean it's part of the issue here is that because they do get paid so much more. We're not asking to get paid the same as them. That's not what we're asking for. But we're asking to be competitive. Again, I have a deputy that's sitting out there right now that has been hired by the PD, and we're training him to never work for us and simply overpay. We have another female that applied for us, was a master's student at WSU. She just informed us Friday that she's going to the PD for pay. And so it's a reoccurring theme, and within detention, we do see people leave to go to other law enforcement agencies. We're seeing them leave to go to Lowe's, to go to these other places for 50 cents more an hour. And so it tells me there is a pay issue there. Well, I've known there's a pay issue there. But again, the compression issue was a total separate issue.
All right, thank you. Thank you, Mr. Chairman.
Yeah, Commissioner Renza.
I guess, so my question is kind of what you were talking about. You know, I mean, there's always going to be some people who will leave for pay, okay? But the question in a bigger thing is, are retention issues and turnover issues really related to pay or something else? Because if they're not related to pay, then you won't solve the problem. And I'm particularly concerned, I'm just, with detention. I mean, people, I guess I'm thinking out loud and asking, you know, what realistic or what people leave detention deputies for lots of reasons. Some of them because they just want to do in law enforcement. That's been going on. I know people when I was in the military police that did that all the time. That was just a way to get there, right? And some people leave. I mean, if they leave for 50 cents an hour to go to a retail place, sometimes it's just the type of work. I mean, I
think there's some of that. I think what we have to remember here with detention is that there is a lot of folks that enjoy doing that job, but they can go. I'll be honest with you, what scares me, the aircraft industry coming in here. 1,000 jobs. I'm not going to have anybody working in detention because they're all going to be making between 17 and 19 an hour starting off. That's where they'll go. This generation simply wants to get paid. The fact of retention, somewhat has to do with pay. Do I think that if we're paying them more, a little bit more to start off with, but that's why we want the 10-step program, because you get them tied in. You get them tied in at 5 years with what they're getting paid, and then at 10 years, they're going to be their max pay at that point. They're tied in 10 years. You just heard we're losing most people at 2.5 years. And so at 2.5 years, they're going to be making a little bit more than they're making right now, and at 5, they'll be making more than they're making right now. And at 10 years, they'll be tied in at a very high salary. It makes it hard for them to leave to go to an aircraft job and get paid less.
I got what you're saying, but is there any, I mean, we have these numbers here. Do we have any, like, evidence or rationale or to think that these numbers will produce the results we need, or is this kind of what we just think and hope will help, I guess is what
Well, I mean, first off, we need a pay raise. I'm going to be very, very honest about that, okay? First off, there needs to be a pay raise, plain and simple. Second, and we're not talking for captains, colonels, and myself. I'm not asking for anything out of this. I'm asking it for the deputies, plain and simple. Years ago, deputies used to make more than Wichita police officers. We had a lot of people applying for the sheriff's office. Over the years here, because of the pay, the way evals are done, and those type of things, it's flipped. And the fact of the matter is, for 5 years, I've been saying we need to pay these folks more, and especially if we want to bring in quality people that also have student loans that we want educations with. It's very difficult to live on cop salaries half the time. And I'm not talking living beyond their means. Do we have some that do that? Yeah. And there's plenty of overtime opportunities to do that. We're hoping to reduce the overtime as well if we can bring in more people to work the job at the base pay and do away with some of the overtime issues, because that's where we're losing a lot of money, is on overtime. Secondly, we just have to, we're trying everything we can to try to recruit people through social media, Facebook, events, those type of things. I've been doing it for 5 years, and we're not bringing them in. But our pay really hasn't adjusted. And so for me, it comes down to now, we need to take a look at our pay, which is something that should have been looked at a long time ago, and we need to take a look at it and say, and if it doesn't, it only retains X amount of people, I still got the rest of the people that are happy that they're making a little bit more money to make ends meet. That right now, they're seeing their people they make calls with and everything else making this much more money than they do. So it comes down to me, they need a pay raise, plain and simple.
Well, okay, well, I was really talking primarily right now about detention deputies. I mean, do we have, I hear what you're saying, but how do we know what the right number is what I'm saying. How do we know?
Yeah, we don't.
I mean, we don't really, we're kind of just.
We don't.
Put the numbers out there and thinking or hoping.
Well, the other issue you have is traditionally detention gets treated differently than commissioned. That's why we've asked for a 5% increase across the board. Because some folks that leave detention, it is about the money. They like what they're doing in detention, but they can make more money if they go to commissioned. And so, for me, I can't ask for a 5% raise for commission and 2.5 for detention, for morale issues and for bringing people in the door and retaining them. So it's got to be across the board, the same all the way across, if that answers your question, sir.
Yeah. Do we have a financial analysis for how this will look like, I mean, going forward 10 years, let's say, whatever we need to do?
Commissioner, we don't have that specifically, but what I would tell you is this is going to look very similar to what we did in the fire district for all those years, where it's based on a date of hire versus date of, like, a January date. So when we looked at this for the fire district and did that analysis, what we typically saw was about 60% of an overall pay pool would actually be paid out in a year. So, for example, if it was 3%, we would look at paying roughly 1.75% of that out over a calendar year. Captain Mattingly described to you that the detention deputies are hired on in January and July. I'm sorry, not the detention, the law enforcement side are hired January and July. Everyone else is hired throughout the year. So we would expect it to look fairly similar. So if we look at the fact that it's a 5% step, and right now the forecast includes a 2.5% compounding base pool plus a 1.5% bonus pool, we're probably looking at pretty comparable increases for the sheriff as what we would see for the rest of the county in terms of overall percentage increase, just based on that 0.6 ratio. And so what I would tell you is
I'm
based
talking
on
year
that,
after
we
year
wouldn't.
for like 10 years. I mean, we need to protect both.
Well, and we can do that. I guess what I'm trying to say is, at the end of the day, it's probably going to look very similar to what they would have had anyway if we left the 2.5% compounding pool and 1.5% bonus pool in there for them in all 10 years. But we'll do the math to show you.
That doesn't seem logical.
Okay, I'll be happy to show you the numbers.
I mean,
Again, it's because you have employees receiving raises throughout the year instead of receiving them all January 1st, which is what everyone else in the
I
county
get
will
that,
do.
but we're talking 5%
Right.
compounding versus, a 4% that's mixed, some of which is compounding, some of which isn't. I get it.
And then it's offset
For
by that
first year-
bonus
for
pool we're
first
not
year
paying
it would be
out.
staggered, but the next year is still going on and on. But okay.
Well, and it'll still be staggered though every year because it is that date of hire. So a
Right.
5%
But
pool.
the previous, I got you, but it's still compounding, is what I'm saying.
Yes. Well,
Yeah.
we'll do the math, and that'll be an easier way to look at it.
Commissioner Enra?
Thank you, Mr. Chairman. I just need to, with all the numbers that have been floating around here this morning, how many openings do you have in detention?
We have 64 as of this morning, and we have 21 in the academy.
And how
I don't
many-
count them as working in the jail yet. So we have 64 openings in the
64.
jail.
And how many in law enforcement?
We have a class of, is it 10 that's in right now? We have a class of 10 that are going to graduate, and then in August we need another 12 because we know there's retirements coming. Most people retire in December. And so we know that we have several retirements coming. So once August hits, the retirement's going to kick in, and we know we're going to need 12 to fill those positions after December of this year.
So presently, to be full staffed in law enforcement, you have 10 openings before the.
Correct.
Okay.
Well, yeah, we've had a few people leave or have been fired. And so I think we're short 2 right now with the 10 that are in the class. But those would be picked up at the 12. Four of the deputies that are in class right now are going to replace 4 deputies to go upstairs, which you approved last year's budget for the additional 4 deputies in judicial.
Okay. So because of that shortage, that demands that you have lots of overtime.
Yes.
And you anticipate that this will eliminate or just reduce over time?
If we can retain people by paying them a little bit more, I think we could reduce some of the overtime, yes.
Could reduce? I mean...
Could reduce. The fact of the matter is that pay is a piece of it, and people even wanting to be in law enforcement is a piece of it right now. And so, I'm not going to lie to you about the fact that law enforcement's rosy right now, because it's not. And it's not a real attractive position for some folks. However, the Wichita Police Department is still getting about 300 applications for their openings. So that tells me they're getting more applications because all you got to do is go online and compare our pay. Well, who are you going to apply for if you're 22, 23 years old? I want to make more money.
But, Sheriff, if you felt those 64 detention positions, wouldn't your overtime go down dramatically?
Oh, dramatically. Yeah.
That's what you're asking, right?
Yeah, I'm just asking,
Yeah.
what's the gain out of the crisis issue? And, I know that having people to fill a position is critical, but, from a financial aspect, paying time and a half for all those positions you're short almost makes this increase less onerous from a financial aspect.
If we can hire more people and retain them, absolutely. We paid what in overtime last year?
About 2.5
million.
Now, I do want to address one other issue, and that's the accountability portion of this. Because what we have found with the range and step, and I don't know if HR's in here, but and they're right back there. What we found in the range and step is we had people that were higher performers. They'd get the 2.8% or whatever, and people who are mediocre performers were getting about 1.8. So you're talking only a 1% difference. And And I think the eval system is plain just wrong. And so we're revamping our eval system that there's certain categories, i.e. if you call in sick too much, those type of things, you're done for the year. You're not getting a raise. The other system what it encouraged was supervisors to go, I'm going to give this person at least an M or meets standards so they can get a little bit of a bump, whether or not they were a poor performer or not, just to keep them around instead of losing more people. That's what it cost. The new eval system, we look at discipline as well, and it'd be a matrix type system on discipline. If you receive so many disciplines, you're not getting your step increase, plain and simple, for a year. So it holds our supervisors more accountable for those evals, and it holds our deputies more accountable to perform adequately so they can get a step increase.
Okay. But everybody comes in at step one.
No. Once they hire on, yes. But what we'd have to do is the current, we have deputies, some deputies have 25 years on, some have 5 years on, some have 6 years on. We have to take each individual deputy and place them into the step that is closest to what they're getting paid right now.
I'm talking about new hires.
Yes, new hires would come in at step one.
And most of your applicants are 20, 22-year-old?
19 to about 21, 22. Okay. We get a few that have retired, out of the military. We get a few that come in from the military that are in their mid to late 40s. We've had a few come in that have been in their 50s. But most of the folks we get are fresh out of high school or looking for a career change when they're in their 20s.
All right. That's all.
Thank you. Commissioner Howell?
Thank you, Mr. Chairman. Just want to go through the numbers one more time. So on one slide you said that the detention normal staffing is 300. That's if you had the 64, your goal is to have 300. Is that correct?
Yes.
So I can assume then right now you have about 236
Yes.
current employees and you want 300. And so out of the 236, are you trying to fill those 64 positions with overtime currently? So basically what that means is for every one of those 236, they have to work around 11 hours a week extra on top of the 40 hours a week on average.
That is correct.
And so that 11
Minimum.
So that 11, 12 hours extra per week, that's time and a half. That's how that works out. Okay. Are a lot of those guys getting burned out?
Yeah, extremely burned out. One of the things that we've been able to, with the jail annex that's under construction, we've been able to infuse 15 deputies into the jail to relieve some of those issues. We've looked at flex hours. We got 12-hour shifts, we got 8-hour shifts, and we got a flex shift because we mandate overtime every day. Plus, they have to sign up for 2 overtime positions a month, mandatory that they have to sign up for, and then they get mandatoried pretty much every day. This morning we had, for first shift, 6 people that were mandatoried overtime, and that doesn't include the 6 or 7 that we had that were signed up to work overtime already.
How many people are on, how many of your jail deputies are on duty at any given moment? Like I assume it's...
A shift is usually about 72 people.
And on average, how many people call in sick on a standard day?
Well, first shift calls a lot more for some reason. We usually get about 4 to 5 sick calls a day. So that's why we want to do that in the eval.
So some of your mandatory is scheduled overtime, but some of you also have to call people in.
Oh, absolutely.
Okay.
Yeah.
Well, it'd be interesting to see how the attrition numbers would change if the overtime was different. I mean, I assume some people like a little bit of overtime, as long as it's maybe scheduled. But
yeah, some of the folks that really, when I first came in here, we had folks that worked 12-hour, 16-hour days, 7 days a week because they wanted the money. We put a stop to that. That's not healthy, those type of things. So they can only work 6 days a week. But we don't let them work 16-hour shifts 6 days a week. And some of those folks that were doing that are now burned out and will work their standard mandatory overtime because they got to sign up for it, but that's it.
Well, it'd be interesting to see, if you reduced overtime, if that would encourage some people to leave because they might like the overtime and they like making extra money. So this time is an opportunity. But others are burned out and they would like to maybe look for something else to do because they don't want to work that kind of overtime. So I don't know. I think
we have focus groups that are within the lieutenant rank, sergeant rank, and deputy rank, and some of those things have been asked. And what we're getting from them is you might have a few outliers that they'll still get overtime because of sick calls. But the standard mandatory overtime and then being fully staffed, there's not going to be as much overtime anymore at all if we can be fully staffed. And so most of them were saying, yeah, I'm ready to go home at the end of my shift working in the facility, plain and simple. And so I can't answer if there would be people to leave, but if there did, I don't think it'd be very many.
So under the current, I don't know, let me ask two questions on comparing the step proposal versus what's current. But right now, someone as a grade 122, what's it take to become a 123 today? Is the position open? And you have so many 123 positions that are open, and
I see.
And you people with highest tenure or whatever, do they move up?
You have to test.
Pardon me?
It's competitive testing for each rank.
Okay, so kind of like the military. I remember I test for a grading a promotion. Time in service was part of that, and then it's you do well on the test and time in service and all that stuff.
There's a matrix that's in all of our promotional from detective, corporal, clicking up to the rank of captain. And so those are all part of it, plus their evaluations.
So maybe the book test, maybe the score is smaller if you have more time in service, but you could promote at some points. Does anybody get to be there a long time and stay as a deputy without going to corporal? I mean, everybody that's been there a long time has probably been promoted to corporal, I would assume.
No, we have folks that have been on 30 years that are still deputies. They don't want to promote.
They don't want to promote?
Mm-mm.
Oh. Okay. Is there anything above corporal for the detention deputies?
Sergeant, lieutenant, and captain.
So okay, so they go from corporal up to sergeant. So like you go from 123 to 130.
Yes.
That's a big jump. And how do you get from corporal to sergeant?
Well, essentially, if you're looking at that, if you're a step 8 corporal, you would go back to a step 2 sergeant. That's a 5% increase.
Okay.
For the law enforcement side, it's down and back 1 for a promotion. For detention, going from detention deputy or detention corporal to sergeant, it's down and back 6 almost.
Well, I noticed that the steps in the deputy, the steps are around 80 cents. The first one's 80 cents, the next one's 83 cents, the next one's 88 cents, and on it goes. The steps for sergeant are several $1,000s each. So by promoting to the higher grade, your steps have a lot more value, of course.
We're having a hard time getting people to promote to the rank of lieutenant and captain. And I tried working on this issue for 5 years in reference to lieutenants getting paid overtime to even out what was going on with sergeants, and it's not doable. So that's why you see the increase.
Because the sergeant gets hourly pay, so the overtime adds to that, so they're actually going to make more money per year than a lieutenant on salary.
And because of the amount of people that go to the hospital from the jail, we have to have armed people to guard those folks at the hospital. A lot of times that's your sergeants that are doing that at an overtime rate.
Okay. If somebody was aggressive in their career and they wanted to get to sergeant, what's the typical progression for someone who's eager to get there?
7 to 8 years.
7 or 8 years?
Mm-hmm.
Okay.
If you're aggressive.
Okay.
Most are right around the 10 to 11 year aspect.
Is there also education requirements?
The higher you move in rank, the more education requirements there are.
So to even test for sergeant, you have to have a certain, like a bachelor's degree, or does it matter?
No. For lieutenant, you need to have college, captain, bachelor's degree is required.
Okay. All right. Thank you.
Sergeant rank, we don't require a college education.
All right. Thank you.
Thank you. Well, we appreciate your presentation today. Is there any action that you need us to take if you're taking this out of the 2019 budget?
We're not asking for an increase in budget for 19. We're able to do it within the funds that are planned to be allocated.
Okay. Well, I think most of us support your proposal, and please let us know if there's something we need.
Okay. Thank you.
Thank you. Mr. Manager, what do you have next?
I think we've covered it all.
We've covered it all.
That's right. Next is budget meeting tomorrow. So it'll be based on the CIP. So we'll have a CIP budget workshop tomorrow.
David is on the hot seat tomorrow.
One of the many.
Thank you. All right, I guess we're adjourned then. Thank you.